Now, if you look just about anywhere on social media, you will see posts about adult ADHD and quizzes to take if you think you might have it. Some experts say that has created a widespread belief that the disorder is underdiagnosed in adults.
It is something that is very clear to our assessment teams, that clients are coming in very well versed on the language. They're very good at describing their symptoms. They've clearly, I think, been influenced in some way, or at least learning about adult ADHD and how it can present.
Now, some medical professionals are warning there may also be a risk of overdiagnosis and potentially serious consequences associated with that. Now, to help us wade through all of that is Canada Tonight's medical contributor, Dr. Samir Gupta. Thank you so much for joining us. You know, I have to say, when we were talking about this story with our team earlier, I know so many people, not just on social media, but in real life, who are adults and who have said, you know what, I wasn't diagnosed with this when I was young, but I feel like I have it. I'm struggling to complete a longer article or get into a novel. Yeah. Tell me, what do you make of this?
I mean, these are big numbers of people who think they have this condition. And you know, anytime you have a prevalence of any condition increasing, it could be a number of factors. It could be that more people actually have it. And, you know, arguably with social media and the way we interact with one another and the environment around us, maybe more people are getting this, more children are getting this. It could also just be more awareness among patients who then will raise it with their doctors, and just even among doctors to make this diagnosis. But the third one is overdiagnosis, and that's a real risk when you have, you know, these tests on social media that you can take, and if you score above a certain number, oh, you have ADHD. This is a challenging...
Which, of course, might have just caught you in a certain moment where you have used a lot of social media that day. Perhaps you're tired, you didn't sleep enough.
They're not validated. You know, that's not the way you make a diagnosis. The way you make a diagnosis is through a very careful history, and that's one of the challenges. Is you can't do a blood test or a genetic test for this. You have to take a careful history. And many of the traits of ADHD are things that we can all relate to. You know, we all exist along a spectrum between normal and ADHD. You know, we call that neurodiversity. But the reality is, if you start talking about, you know, trouble organizing tasks or prioritizing tasks or following through, or I procrastinate a lot, you know, that's all of us at some point. So it's very easy to look at those self-tests and start over-diagnosing and self-diagnosing. And I think a lot of that is what we're seeing here.
Take a momentary behavior as a kind of a more acute symptom. And of course, there is the danger of this, right, is that we know that resources are already stretched too thin. For example, for children who genuinely need help with ADHD, or adults for that matter.
Yeah, so you know, the real prevalence is probably around 5% for adults. So if many more people think they have it, then yes, they're seeking those resources, but also they're getting treatment inappropriately in many cases.
In other words, don't take the online quiz, maybe just go see a doctor.
That's right, talk to your doctor.
Okay, great. Moving on to UHN, it's announcing the reinstatement of a mask mandate. This is University Health Network, major network here in Toronto. Why this October? Why now?
Yeah, I mean, this is, you know, it's not just this hospital, it's most hospitals, my hospital as well. And, you know, this is respiratory viral season. This is the time. And we talk about the tridemic, which we've talked about during pandemic times, with COVID, flu, and RSV being the big viruses that cause a lot of the morbidity in this season, in the respiratory viral season. This is when they start, and they become more intense as the weather gets colder and people tend to congregate indoors, where all of these viruses are spread basically in the same way, through droplets and through the air. And so this is a very practical thing, I think, not just for healthcare settings. So definitely for healthcare settings where more people are sick, there's a higher chance that you're going to be exposed, and healthcare providers have a duty to protect their patients because those patients are vulnerable. But also just in settings like subway cars, where I wear a mask and where a lot of people are still masking. And this is a behavior that in many parts of the world, in Asia, was very common before the pandemic, where it's respiratory viral season. I might be sick, I might be pre-symptomatic or asymptomatic, so as a courtesy to others on the subway, I'm going to wear a mask. I'm also going to benefit by, you know, protecting myself from others.
Protect yourself and protect others, right?
Exactly. And so I think this may be a silver lining of the pandemic, that masks have been normalized, we're used to masks. And we can do this. We probably should have always done this in healthcare settings at this time of year, but this will reduce transmission.
How effective do you think this mask mandate would be? As you've said, I've seen a lot of them on public transport as well, but with each passing year that we're further away from that first stage of the pandemic, it does seem like there needs to be more public justification to people as to why they should wear a mask. So now that this mandate is in place at these hospitals that lots of people go to, do you think it'll work?
Yeah, I mean, I think it'll be enforced in hospitals. With respect to do these mandates work, you know, that field of research came a long way during the pandemic because, you know, this was happening and there was so much study of this question and so much debate. If you look at on a public health level, and there were benefits in jurisdictions that had these mandates or had them earlier or more significant mandates did better in terms of reducing that transmission. But we also had a lot of data from specific settings like hospitals or homes where someone was infected or school settings. And we found from those data as well that masks reduce transmission. This is a barrier. So, you know, less droplets out and less droplets in. And so I think this will be effective, particularly in those high-risk settings. And I think that should go beyond hospitals. I actually think it should go to waiting rooms, doctors' offices, you know, where a lot of these viruses are being spread at this time of year. And it will save a lot of people from getting sick at this time of year.
Sounds like a win-win situation. Dr. Gupta, thank you so much.
My pleasure.
Canada Tonight health contributor, Dr. Samir Gupta.